Hey guys, my name's Lexi.
My name is Christy.
And my name is V.
And we're here today to teach you a little bit about rheumatoid arthritis. Which has affected us not only personally but also globally. And HealthyPeople2020.gov has made it an objective to reduce the disability associated with RA. So Christy is going to tell us a little bit about that.
Rheumatoid arthritis is a systemic inflammatory disease and an autoimmune condition which manifests itself on multiple joints on the body. This inflammatory process primarily affects the lining of the joints, mostly the synovial membrane, but it can also affect other organs as well. The inflamed synovium leads to erosions of the cartilage and bone, and sometimes joint deformity is produced. The etiology of RA is unknown, but is believed to be a result of faulty immune response. Many cases are believed to result from interaction between genetic factors and environmental exposures. RA occurs globally, affecting all ethnic groups, and it can occur at any time of life, but the incidence increases with age, with women being 2 to 3 times higher than men in getting RA. Geographic distribution in RA in the United States or worldwide. A recent systemic review of the existing studies suggests that RA is more common in Northern Europe and North America than Southern Europe, Africa, and developing worlds. There is also evidence that the incidence of RA has declined in recent years in the United States and Northern Europe. So this topic is of relevance because it affects 1.2 million Americans, and one of the objectives that we focus on for HealthyPeople.gov is ALCBC3, which is to reduce the proportion of adults with doctor-diagnosed arthritis who find it very difficult to perform specific joint-related activities.
And the signs and symptoms of RA vary from person to person, but usually a nurse during her assessment, she'll find subjective findings such as fatigue throughout the day, generalized weakness, especially in the morning. The patient will also complain of increased pain that really reduces mobility, and it's usually worse in the morning, and it usually starts with the hands, with the metacarpals, and then it can progress to the formation of nodules in these joints, which just further increases the pain, making it even more debilitating for the patient to perform their activities of daily living, such as brushing their hair, showering, or even trying to work. The patient will also experience weight loss and anorexia, and then some patients even experience inflammation of the eyes, especially the sclera. The risk factors for RA include gender. If you're female, you are 60% more likely to have RA than men. Also, if you are between the ages of 20 to 30 is usually when the first signs and symptoms appear. It's usually joint pain. There's also a genetic link, and it's primarily found in Caucasian women. Another risk factor includes obesity and immobility. Also, if you have an occupation that requires a lot of bending of the knees, the rheumatoid arthritis can first be manifested in the knees as opposed to the metacarpals. Diagnostic testing for rheumatoid arthritis consists of, number 1, the ESR, which is the sedimentation rate, and CRP, or C-reactive protein, which will indicate an inflammatory state. They will also test for anti-nuclear antibody titers. All 3 of the tests that I've mentioned, they're all done by blood, just a venous sample of blood. They might also test for the anti-citrullinated protein antibody, or ACPA. It's another important test to diagnose RA. And then they may draw synovial fluid from the affected joints, which would show a straw-colored fluid with many fibrin flecks and an enzyme MMP3, which is found in those suffering from RA. And that might also indicate how advanced the joint deterioration has become. And also the white blood cell of the synovial fluid is going to be elevated up to 25,000 microliters, and inflammatory changes in the synovium can be confirmed by a tissue biopsy.
As for complications, 1/5 of people with rheumatoid arthritis develop lumps of tissues called rheumatoid nodules under the skin, particularly in the elbows, forearms, heels, and fingers. Also, inflammation of the episclera, a thin membrane that covers the sclera or white of the eye, is a common complication of RA, and it can become very red and painful. Most people with active RA experience a reduction in red blood cells, which is also called anemia, and people with RA are more prone to infections, which may be related to the underlying disease itself or the immune suppressing medications used to treat it. Unfortunately, prevention of RA is not possible based on the current state of knowledge. However, early treatment can help prevent further joint damage. Some of the evidence-based treatment for RA are involved in DMARD therapy, which is one of the drug is methotrexate. It is a rapid anti-inflammatory effect that reduces clinical symptoms in days to weeks. Another one is sulfasalazine, and the anti-malarial drug hydrochloroquine and tofacitinib. Corticosteroid therapy can be used for symptom control. Various NSAIDs and salicitates continues to be included in the drug regimen to treat arthritic pain and inflammation.
According to the CDC, in 2009, there were over 15,000 hospitalizations associated with the acute exacerbation of rheumatoid arthritis. This accounts for over $545 million spent annually just by U.S. citizens alone. Most of the people that do experience acute exacerbations are women, and they're usually around the age of 45. Although this incidence is decreasing since 2009, there is still room for improvement, which includes early detection and management of the symptoms with drugs that V mentioned, such as corticosteroids and NSAIDs. Another complication associated with RA that nurses tend to forget is the emotional burden. Most of the patients that have RA do experience some form of depression or anxiety that usually accompanies their loss of function because of the painful movement of their joints and usually their fingers.
Okay, so rehab techniques include appropriate periods of rest and activity modification, therapeutic modalities such as heat, cold, or electrical stimulation, bracing and adaptive equipment. Rest and energy conservation can be helpful for locally inflamed joints, but should be avoided long-term due to potential deleterious side effects. A structured exercise program can be greatly beneficial to the overall well-being and functioning of the individual with rheumatoid arthritis. For non-inflamed joints, active or active-assisted stretching of all major joints is essential to prevent contracture formation and maintain the current range of motion to perform most activities of daily living. Strengthening exercises can be utilized in non-inflamed joints, while isometric exercises can help maintain strength to prevent injury or facilitate fatigue. So some other rehab therapies include superficial and deep heat, aerobic conditioning, and cryotherapy. RA patients can also join the local RA community to gather support from other individuals suffering with RA.
The overall goals for patient with RA is 1. Have satisfactory pain management, 2. Have minimal loss of function ability of the affected joints, 3. Participate in planning and carrying out the therapeutic regimen, 4. Maintain a positive self-image, and 5. Perform self-care to the maximum amount possible.
So as nursing students, we believe that it's important as future nurses to manage your symptoms early to minimize acute exacerbations from rheumatoid arthritis.
That's right. And remember, as nurses, we're the patient's biggest advocate in their care plans. So we need to remind them to keep up with their medications, to do their stretching exercises, and to maintain all their follow-up appointments. And of course, tend to the mental aspects of the disease.
Thank you for watching, guys, and dogs up!
Dogs up!